I'm Mike Sawstruck. I'm the chief of the Portland, Maine Police Department. Here we've had a police mental health collaborative program since the late 90s, and it would be commonly referred to as a co-responder model, which means that our sworn uniformed law enforcement officers are responding to emergency calls for service with trained mental health professionals. So with the idea being that they walk through the door as a team, as a partnership. Really the core functions of what we do in law enforcement, we know that the majority of what we do day to day involves some kind of nexus to behavioral health issues. Behavioral health issues being substance use disorders and mental health issues. So if we're not addressing those two problems accordingly, then we're not doing our jobs effectively. Well, I was blessed really to be in the first crisis intervention team training that came to the state of Maine back in 2001. So I've really been operating within the system since it began. And then after that, as a chief, about 5 or 6 years ago, we made the commitment that I wanted all of our officers certified because I believe it's that important for everything that we do. The very first thing we wanted to do is train ourselves internally. So 100% of our officers are crisis intervention team or CIT certified. You know, when we provide our officers with additional skills around communication and de-escalation, that makes everybody safer. That makes our consumers, our clients safer, our community safer, and it also makes officers safer. I can tell people, and I'm proud to say I was in the first CIT class in the state of Maine, I can tell people where we were in 1997 when I started in comparison to where we are today. I'm familiar with the things that come up when you're trying to change the culture of not just an agency, but of a profession. And that's not an easy thing to do. So change is a scary thing for people. So you just have to be able to walk them through the steps and explain why this is so important. And I always come back to two simple facts when you want to change anything in law enforcement. And you change culture by focusing on officer safety issues and resource allocation issues. So when I'm talking to other chiefs, I always have conversations around those two items. When we talk about officer safety, I tell people, the chiefs, that your officers are going to be safer because of these programs. And your clients are going to be happier. And then you start talking about resource allocation. From an agency standpoint, 30,000-foot view, I'm looking at our officers and what they do day to day. Maybe a formal workload analysis. It may be just talking to street cops about what you're doing. What are you facing out there? What frustrates you? And I think if a chief walked into any locker room in any community in this country, they're going to again come back to those behavioral health issues. So we need to do a better job providing some tools. And the vast majority of police departments across the country are very small and they're very rural. So police chiefs say, I don't have the officers or the money to send people to a 40-hour crisis intervention team training. I can't afford to do it, is what I hear. And my response is always, you can't afford not to do it. It's that important. It's a core part of our mission. We need to do a better job. And I don't want those chiefs to be standing at a podium answering questions about why their officers aren't trained. Why couldn't they afford to send somebody to a week's worth of training? I've got 3 cops. I can't break somebody loose. But if you're going to the same house 30 times in a month to deal with the same problem over and over and over again, then you're losing resources on that side as well. Something I also always say is you're going to pay now or pay later. Pay now. Train your officers, treat people with respect, and then you're not paying later with the criminal justice system, with the hospitals, and things of that nature. That revolving door is not the way to do business. To have the training is one part, but you have to have the relationships. You have to have the collaborative partners in your communities to make this work. So how does that scalable? I think it's very scalable in the sense that chiefs need to branch out. They need to build these relationships, whether it's a single practitioner that may be in their community or maybe in their county in some cases. So take care of it on the front end, front load this issue, and work with your people. Everybody's going to be happier for it.